Hi, this is Dr. Khalifeh. Today we're going to show a video on the injection of lips. Today I'm using the lip filler called Rejuvenation Lips. It's a little bit thicker than and more cross-linked, which will help hold the lips a little bit plumper and help it last longer. Next. Okay, so we're going to start laterally. I like to start at the corner and accentuate the border of the lips. It is important to inject very slowly, so each time the needle goes in, the amount of product being pushed is tiny. And that's because if you do too much in one spot, the patient will feel the product as a lump. Pause. After the border is plumped up, we're going to go in and do one layer, again going very slowly. And this one is more vertically angled. With lips, one tube of filler goes a long way. You rarely need more than that. As a matter of fact, those that start getting more than one tube, you can lose the shape of the lip and get kind of a little bit of a weird looking result. So I always recommend one tube. Probably can be repeated every 6 to 9 months if desired. Now, after injecting with the vertical direction, we're doing a little bit of horizontal direction. We're bringing in, this is the line that separates the dry mucosa to the wet mucosa. What we're doing is going from the dry, injecting it into the wet, and that's going to evert and really help enhance and plump up the lips. Now we're going to treat the Cupid's bow and philtral area. And for that part, I like to go at an angle to preserve the angled nature of the lip. And it's important not to efface or disrupt the difference between the philtrum and the rest of the lip. Next, the last part of the upper lip, we're going to inject the philtral columns. This part stings a little bit because we're very superficial. And it doesn't take a whole lot to create a little enhancement of that area. And again, she has already a nice one, but if you're treating a patient that doesn't have this feature, it's nice to create it for them. Usually with age, you'll lose that. Okay, now we've completed the upper part of the lip. We're going to use the rest of the tube to enhance the lower lip. For the lower lip, I like to do longitudinal injections, again going very slowly. Thanks. Again, we're injecting the lower lip in slow passes. So every pass, just a little bit of product is dropped. Just to give you an idea, we've probably been injecting this lip for 10 to 15 minutes. We cut the video short, otherwise it'd be very boring. But it's, if you go to a place and notice that the injector is in and out in 3-4 minutes, they're probably not going slow enough. Thank you. So now we've completed our treatment. We started out by injecting the nasolabial folds and then came into the center and injected the lips. 2 tubes of fillers were used, 2.4 cc's because the Versa tubes contain 1.2 cc's.